Good evening. My name is Kristen Sanders,
And I'm Nick Sanders.
and together we have chosen the Certified Nurse Midwife for our advanced presentation. Okay. According to the textbook for Blaze and Hayes, 2016, with graduate education, nurses are able to assume the role of advanced registered nurse practitioner, and with it a range of new opportunities, skills, knowledge, and ideas. Nurses with graduate degrees can influence the healthcare system from within by assuming positions of leadership in administration, education, and practice. With expansion of the nurses' roles, the more they can specialize. The purpose of this presentation is to describe a specific specialization and increase the understanding of this role in nursing, which is the certified nurse midwife. Why it interests the group, I have a personal interest in it and to getting into the program. I have a fascination with the birthing process and empowering women to make health-related decisions and provide information to women about their biology from menarche to menopause, and that everything in between can be physiologically normal. Certified nurse midwives participate in 9% of all births in the United States of America, with a projected job growth of 29% between 2012 and 2022. And certified nurse midwife use has grown almost every year since 1989, signaling a rise in the profession, as they can be primary care as well, especially in areas that are rural with limited access to health care. The requirements and qualifications to become a certified nurse midwife starts with a bachelor's in science of nursing, and for the nursing midwife, or any bachelor's to become a certified midwife, but we are focusing mostly on nursing midwife. The program awards either a master's or a doctorate degree depending on the institution or the state, and the course must be accredited with the Accreditation Commission for Midwifery Education and or the American College of Nursing Midwives. Certification is obtained after testing from the American Midwifery Certification Board. The job responsibilities of a certified nurse midwife include the diagnosis, treatment, management of care of pregnant women and new mothers throughout the birthing process, diagnosing, treating, and managing care in primary care, the delivery of newborns, and attending pregnancy issues that don't require intervention of obstetricians, the counseling and educating females from puberty to menopause, conducting physical exams and keeping patient histories, ordering and interpreting diagnostic results, and prescribing treatments and medications on a state-by-state basis. The standards of care include promotion of advocacy of health in all women from menarche to menopause, understanding of human sexuality, including biological sex, gender identity, and gender roles. They promote the health and well-being through evidence-based midwifery practice, engages in professional relationships with other healthcare providers. Midwifery, they also ensure that it occurs in a safe environment within the context of family, community, and system of healthcare. They ensure that midwifery care is documented in a format that is accessible and complete, and they evaluate the outcomes to improve midwifery practice. The certifying organization is the American Midwife Certification Board, and the professional organization is the American College of Nurse Midwives at midwife.org.
So certified nurse midwives are having a positive impact on the nursing profession as a whole. They are helping with the current nursing shortage. So according to the World Health Organization, currently there is a shortage of healthcare workers, and nurses and midwives account for 50% of that shortage. COVID-19 has made this even worse, with many midwifery practices furloughing staff. And there is the highest need in rural for midwives in rural areas of Southeast Asia and Africa, where women are having difficulties gaining access to healthcare providers. But there's also areas here where they're in rural areas where they're helping to fill that shortage as well. So there's several positive outcomes associated with the use of a certified nurse midwife. There's higher rates of normal vaginal birth when compared to pregnancies followed by an obstetrician. Childbirth is more likely to be managed by a professional that is known to the patient because they spend so much time developing a relationship with the patient. There's higher success rates of breastfeeding, nearly a 25% chance, a higher successful rate, and help provide a sense of control for the patient because they spend so much time developing that relationship that they can get a clear idea of what the patient's goals are and help them achieve that. So nurse midwives are leading reform in the healthcare system. They're reducing the number of unnecessary procedures. Episiotomies go from nearly 25% in pregnancies that are led by obstetricians down to 3.6% in pregnancies managed by a CNM. There's also lower rates of C-sections, which fewer procedures also means shorter hospital stays. This reduces the overall cost of childbirth and helps to reduce the financial burden on the healthcare system. And they're also increasing access to care. There's many rural areas that can't support a large obstetrician practice. So nurse midwives are helping to fill those gaps there. So overall, the certified nursing midwife profession, they provide a supportive relationship throughout the entire process. They help improve patient outcomes in several key areas. And it's a rapidly growing field. It's something that patients like. They like having building that relationship with a certified nurse midwife. And that's it. So thank you for learning about certified nurse midwife with us today. I hope you enjoy it, and you have a good one.